Olá pessoal, estamos aqui no Deep Plane Brasil 2026, uma edição fantástica, gigantesca, né? E com uma alegria muito grande estar aqui com dois grandes amigos, né? Meu nome é Waldemar Penna, eu estou aqui com meu amigo e meu advogado, Dr. Davi Stacciarini, e estou com um dos meus maiores amigos dentro da cirurgia plástica, Dr. Gad Renert. I'm here with one of my very best friends in facial plastic surgery, Dr. Gad Renert from Romania. E estamos aqui para conversar um pouquinho sobre o Dr. Gad, sobre a experiência dele, né? E vamos fazer algumas perguntinhas, tanto pessoais quanto profissionais, né? Para vocês poderem conhecer essa pessoa excepcional que é o Gad, né? Que a gente pôde contribuir um pouquinho na vinda dele aqui para o Brasil, né? Essa estrela em ascensão na cirurgia plástica facial. Dá visão.
Well, I think the first thing when we speak about Romania, three things come in my mind. Okay, the first one, of course, Dracula. I have to say. The second one, Nadia, of course.
First cousin.
Yeah, I think it's the third one. Nadia is the second for me. So the third one, of course, are you, Professor, Doctor? And I think you right now are very famous in your country because you start, attempted patients, very famous patients, celebrities, and you do technique. I think is amazing. Like how strong influential you have in Brazil with endoscopic surgery for all of us. So my first question is, how you work with quiet luxury? Because I think
With?
quiet luxury, this
Quiet luxury.
quiet luxury.
Quiet luxury.
Yeah. Because I think this is most patients look at you about this kind of conception.
Patients want, it's hard with endoscopic technique to satisfy everybody.
Yeah, of course.
Because it's not as easy to customize like a regular facelift, because you're operating from one keyhole and you release the whole face. This is my technique, the complete release of the face in the deep plane with the ligaments and everything. And you rely on this release, but if a patient doesn't want her upper face to look very different, or at least a little bit different, then it's very hard to customize just this area because you will have skin excess. And it's hard to do it for all patients, and at least for very famous patients, it's very complicated because if you, they don't want something that will be recognizable. So you need to be to choose the right patient. Everybody wants a scarless facelift. Everybody.
No challenge.
No question about that. All women and men want it without scars.
Nobody likes scars.
Yeah.
But you can't really do everything only like that. Sometimes you need to just do what's suitable for the patient for her needs. So if the patient wants her upper face and mid face to rise and everything, and you can also customize the lower face according to her demand, so that's okay. But you need to talk with them a lot, and the psychological impact of these surgeries is quite big because they don't recognize themselves in the mirror in the first weeks. Not like in the deep plane facelift, when you do, everything looks good after 1 week, 10 days. So you need a bit more time to adjust because of the total repositioning of the face.
And the fact that you do not take out skin, maybe sometimes you have to overcorrect.
Exactly. Sometimes, no, you have to overcorrect because you don't take out skin, but after everything settles down after 3 months, if you don't overcorrect a little bit, it will come back to the way it was before. So you need to explain to the patients, I still haven't found, I'm working on different methods and formulas and internal stitching in order to make this process a bit less long of the healing. And you need to talk about it with the patients. It's very important. It's an issue. You need to step up your game a little bit in patient education and in the first weeks after the surgery, how to handle them a little bit, because you need to prepare them psychologically for that.
Yeah, I can imagine.
Even if they look beautiful, I have a patient, recent one. She looks so good after the surgery because you don't see any marks on her face. She's just a little bit cattish, but it looks very nice even like that. And anyway, it will go down considerably. And it's hard. She told me she cannot recognize herself in the mirror, and they get anxious about that. But it's not a problem. We need just to address that correctly.
And do you think that how internally, how are you facing the fact that you are now a standard for people in endoscopic surgery? Because, you know, I pride myself on being an endoscopic surgeon for a long time, but I have completely changed the way I look at endoscopic and the way I do things after I went to Romania twice just to learn from this man. And you, how does this settle inside internally for you, having this fact that you now...
It's a great honor to be considered as one, but I just wanted to improve the technique, to do logical things in the face endoscopically. This was the most important for me. I didn't plan to that everybody will,
it fell in your lap.
Will know my name. No, I like it. It's nice, but it's also a great responsibility. You need all the time to be sure that what you are doing and what you are telling people, because now I'm not telling just you when I'm saying something, and people trust what I'm...
Yeah, everything you say has a weight.
What I do, and now if I change something, or I need to think a lot about how to communicate this change. Is it good? Has it stood the test of time? And you need to just to be responsible, and it's a nice feeling. I still don't get it, you know.
Yeah, you're between friends now.
I'm very happy about everything, of course.
Nice. Amazing. So I think one of the questions I have, I know your clinic is also very famous in Romania. Do you have some special journey for the patient when you go to clinic? So I think from celebrity point of view, you go to your clinic, how you work with them?
Well, it's the most beautiful clinic I've ever been to.
Thank you.
I have to say,
it's a modest clinic.
No, it's
a nice clinic. And what we do depends on the patient. First of all, now, it doesn't matter if the patient is a celebrity or just a normal person. It's not important.
All right.
I treat them the same. What's important is to listen to them. You need to listen a lot to the patient. This is very, very important, because sometimes you can make mistakes if you don't listen enough. And even if you're 100% sure that the patient, that you understand what they want, ask him again. Be very specific and try to be very, very clear in what you explain. Now, I don't do anything special in the clinic you just need to take care of these patients with everything. We have a lot of pre-treatments that we do. If we need to do smaller surgeries before, in order for the patient and us to be comfortable with one another, we do that. And we have a post-treatment protocol that's very, very standardized for each patient, not to have people that are healing and have a situation that they don't know how to handle. So we do all that. It's mandatory. If you do just the surgery and leave them alone, it's not okay.
All right.
Gadi is a guy that is multicultural. He was born in Israel.
Yes.
And lived there till he was like
23. Yeah.
And afterwards went to Romania. What do you think about being in Israel and afterwards being in Romania? What has changed in terms of yourself, the way you look at yourself?
Well, a lot of things changed. I went to Romania to study medicine, and I remained there. It was a hard decision because it wasn't considered something good to do, to remain former Eastern Bloc countries and practice there. It was okay to study medicine and then just go to another place. So it was hard in the beginning because you don't get the same exposure and education and the quality of training that you get in other countries, but it helped me to focus myself a lot and to be very, very clear about what I want to learn and what I want to become, because you don't receive it
You have to work.
normally. You need to be very focused and just take from here, take from here, take from here a little bit all the time, and to be clear with yourself about what you want to become. You cannot be a reconstructive and aesthetic and head, and you need to focus. And
Choose a path and follow it.
and I did that, and Romania is a country, still is a country of great opportunity, a country in very big growth now, and Romanians are amazing people.
Yes.
I love them very much.
Very hospitable.
And I love Romania. I couldn't work in another country, really. It changed me a lot. It made me, I'm half Romanian now, really.
Yeah, yeah.
Even though my Israeli side is alive and kicking.
And do you feel like Gadi's his wife Norina is one of the nicest person in the world. She's a high-end fashion stylist in Romania, one of the most famous in Romania. Do you feel like the contact that you have with the fashion world helps your artist's eye to operate?
It's a lot of small things when you have a partner like that. And she's a lot like me. She went from a big fashion factory in her very young age, to now be a boutique designer doing only special things like the endoscopic surgery, you know. So we're very like-minded in this thinking. Of course, it helps. Everything she does, everything she touches is beautiful.
Yeah.
She is beautiful, and she inspires me a lot. And I'm not creative. Maybe I have good hands, but
You think you're not?
I'm not so creative. She's very creative, and she gives me ideas. And the small things, the everyday talk that, you wake up with something, you don't even know it, because I was with her and talked with her, and she really inspires me. And I don't think I would really manage to arrive so far without her. She's
Nice.
an amazing person.
Nice. Yeah, she's the best.
Okay.
Luizão.
Well, I think Romania and Brazil have this kind of both very strong cultural cosmetic procedures.
Yes.
Of course, the Romania design
yes,
a lot,
yes.
like Brazilian, you
Yes.
know that. Have you seen any technique or procedure in Brazil that have influenced Romania?
Oh, many, of course. In liposuction and in body contouring, everybody wants the Brazilian the Brazilian body contouring. So that's...
And this is so funny because you influence us with endoscopy,
yeah,
right?
I couldn't believe it, when I was talking to Dr. Waldemar told me there's nobody who does endoscopic surgery in Brazil. It was like 3 years ago.
No one
Change
does
everything.
And after you came and I came to
I spread the word.
people came to the lectures and saw a little bit of surgery and everything. Now there's a lot of endoscopic surgeons that do plus minus the same surgery, and it's amazing. You are
Including our
congratulations
friend.
for you also.
Thank you.
Common
Thank you.
friend,
Amazing.
is he also Mattioli?
Yeah.
Fernando Mattioli is our common friend. He say we have a deep plane before endoscopic and now after endoscopic. It's something very different. Something that changed forever. He told me every time I talk with him, he say, "It's changed everything, David. After endoscopy, it changed everything."
Yes,
So
not
it's
every,
amazing how
not every face requires an open face.
yeah, sure, of course.
Doesn't matter the age. Not every face requires an open face.
How you do this? This is sorry for the second question. You told us about you work the same with the patients. Doesn't matter if he's a celebrity or not. I think it's great. Can you imagine a patient go to your clinic and he have high expectations? This is very common concept for us.
Yeah.
High expectation, and you start to think, okay, can have you do this or not? Maybe because of the high expectation. How you work with this?
Yeah, it's hard. First of
How
all, it's
hard it is.
It's not 100% success here.
Yeah, sure.
Because it's a lot of intuition. a lot of intuition. I do refuse patients with very high expectations. I do, because I know there will be a lot of trouble with them afterwards. So I do refuse people, but I try also to give them the expectations that they want. I talk with myself. I have a little talk in my head before I refuse, and I say, "Gotta think. Maybe you can give him this what he wants, and maybe it's not so bad. Maybe okay, just let's talk a little bit more. And if I see the patient that he can go down a little bit, like 10%.
You know,
I can work with that.
One thing I've noticed with patients, I stayed for a couple of days in Romania both times. I noticed patients really trust Gadi, and they
yes, but it shouldn't. When somebody trusts you,
it's something different that we see in your day to day, because we all sometimes we need to do a little bit of touch up, or
yes,
not doing the whole procedure when we want to do everything, but you can, like, no, I won't do this today, I'll do it in
but I can do that, yes, yeah. And I do that. I do that a lot. I do that. I stage a procedure. Yeah. Sometimes when I see somebody's all over the place, wants to be like, I don't know, completely different. So I stage the procedure. I can do the nice thing about the endoscopic lift, because you have just one access point. You don't have to work behind the ear. So first you do the whole face, and then you do the neck in another time, and then you get amazing results, and you do it in a more convenient manner.
Something that I see every time now, I think Waldemar can't say more. We start with more older patients, but right now, all younger want to do this. Younger patients want to do endoscopic, want to do the plane. I think Val is already work with the guys like this. I can imagine how your clinic is. Many young guys go there. I want to be more attractive in this. How this is the thing. We start a new kind of cosmetic procedure, a new kind of plastic surgery.
New kind of patient also.
Yeah, it's kind of new patients also.
Yeah. A lot of young patients come. A lot of young patients that you couldn't do them before. You just with very complex cantoplasty, cantopexies, which are not recommended in this age, So it opened the door, sometimes it opened it too much. But no, it's a beautiful procedure.
Is this? You think your conversation that you have with the patients, younger patients, you talk more about attractiveness, the beauty of the face, or something like this, or not? Don't care. They follow you blinded.
When a young patient comes, it's usually because they have a problem. They have their negative tilt of the canthus. They have their brows like that. They don't feel good about themselves. Maybe they have too much fat here and everything down. So I need to reposition the face. This I understand. It's 10 minutes talk. It's not important. Okay. But when a beautiful girl comes and she wants endoscopic lift, there you need to be a little bit careful, because, okay, I can do that, but why does she want it? Does she need it? Who is she? Is she normal? And I have a lot of refusals that young, not so young, even 35, 38 girls come, but they're still amazing, they're still beautiful. And they want this endoscopic lift, they want a little bit more. I said, this is a major procedure, it's not a little bit. Yeah. It's a lot what we do inside, and I don't think it's okay for you now. You should wait a little bit, a few more years, because the innocence and the youth of your face, my knife cannot give you that. My knife can make you more Instagrammable, but it cannot bring you the innocence of the looks that you still have now, even with these tiny wrinkles.
Nice, nice. Do you feel like there's something that the patient do in terms of injectables that will give you like a very hard time?
Oh yeah. Now I'm very, unfortunately, 95% of my cases are very hard. Okay. All of them. There is no
virgin faces.
No virgin faces anymore. And they're full of everything. It doesn't even matter. Don't even ask them anymore. I don't care. I just do the job. It's hard. It's dangerous. You go around the nerves and everything is stuck. But you learn to live with it.
Yeah.
And
It's a reality.
There is nothing to do about. I don't know what can you do about that. Nothing. You cannot refuse them.
You know, there was a very big surgeon in America that did like a crusade against a particular type of injectable, the biostimulator, one with calcium.
Yes.
And he got a citation from the law, and he was threatened like with a $2 million.
Yeah,
suit.
they have a. There's nothing to do about fillers. They're so powerful.
Yeah.
And the people do them relentlessly. So this is an industry a million times bigger than plastic surgery. So,
yeah. And I don't think filler is the worst.
There is
for me,
everything is bad. Everything is bad. Everything is bad. Biostimulators, but there are fillers who are also biostimulators, and there are threads, and there are energy-based devices, and the list goes on and goes on and goes on.
How you guys see this? Like, let's say, become a new technology coming right now. How you know is that just a trend, or maybe this is the thing? This is the thing. They will stay. How you both look at this?
About endoscopy?
I think in cosmetic procedure and in face in general. So you have something new. It's like, okay, this is the trend or not?
No, I think the facelifts have become so good and so powerful and so natural, and also the endoscopic improved a lot. So and has started to become more accessible, because I don't know, 5 years ago there were just 5 people in the world, or I don't know how many, who did complete facelifts endoscopically. There were not so many, and it was impossible to get to them. Now there are in each country at least one surgeon who does it. So I'm proud of that, by the way.
But not only the surgery per se. Like say the morphos, the technology. So I use a little bit here in the neck or something in the patient.
Well, it's good. It's like
There's a trend. Maybe it's good now, but
it's like a CO2 laser, which will always be there. But I don't know. I think Morpheus is here to stay. People want procedures that you can do and recover immediately.
Exactly.
So that's very important. They will be forever, these procedures.
Sure.
They will improve. They will bring better pins, better devices, I don't know, and people want this.
You have to have this. So I think in your field, cosmetic procedure in plastic surgery, kind of the patient wants to have all the trends, all the new things.
Of course, they ask for everything new. This is
even if it don't work, but they have to have.
Yes, we have a whole department of exosomes and everything. They love it and they pay a lot.
It would just change like a little bit.
I don't see nothing. My staff told me they're beautiful. Look what a difference. I don't see nothing. But okay.
She's happy.
They're very happy, and this trend will never go away.
Yeah.
Because people want to feel good about themselves, and in a non-invasive way. Not everybody is fit for surgery. Yeah. They usually go through all the experiences of non-invasive, and then when they see nothing happens anymore, they go to surgery. Yeah. And this, I don't know if we can change that.
This is like you guys told before. We don't have virgin faces anymore.
We just need to be very skilled and very good, and not to have complications, neuropraxia with them, and paresis. This is the most important thing, not to have.
And about this thing now, this is a new kind of question. I have nothing to do with this, but I'm very curious about artificial intelligence, AI. How you think about this?
Well, I see a lot of people using it in many ways, not necessarily
only Instagram. The people
not
in
necessarily
science.
medical, but in science and in everything. It's very useful. I don't have a lot of experience with it because I'm stuck in the endoscopic all day. But I think that in maximum 2-3 years, it will revolutionize everything. Because the steps, today it's a small step, tomorrow it's
a little bit bigger. It's incremental.
It's exponential. So I think it will not take more than 2-3 years for it to really take over everything we do.
Gary, what would be the message that you have for people in Brazil that are looking up to you, and for us to summarize our podcast, what would be the final message that you have for us?
So don't be afraid to learn new techniques. Don't be afraid of the endoscopic facelift. If you feel that you can do it, if you want to do it very much, there are ways to do it. You can come to our course.
You have a course?
In Barcelona, sorry, at the 16th of October. And this technique is very hard to come by if you do it by yourself and you go from meeting to meeting, and you need to really very, very good theoretical basis, very guided dissection on a cadaver, but guided, and you need to do it at least 2 times before you try to do it by yourself. And I think this course is very, very, it will be very good, very important for those of you who want to learn endoscopic surgery. And you can always give me a call to ask questions.
I always say that it's very funny because everything in terms of anatomy that we have in open surgery, it's quite like the opposite in endoscopy. You're looking at things in a different angle. So you have to relearn
very
the
clear.
anatomy.
You see them very clear, and I love it.
Like you have to relearn the anatomy in terms
Yes.
of which way are you going to look? Are you going to look upwards? Are you going to look
Yes.
sideways?
Yes,
And you should learn with the endoscopic mafia. It's going to be in Barcelona.
It's going to be a life-changing event, very, very important course. There will be me, Mark Manny, Dr. Mubaris, Faisal Al-Kuhen, Arthur Carandel. We'll talk only about endoscopy without anything else, and show the technique, and step by step, really, in a meeting you get lost. You cannot do all of that. You need a special course for that, and we are doing that.
Perfect.
Perfect.
Pessoal, muito obrigado por estar aqui conosco. Thank you, Gadi, very much, my friend.
Thank
Thank
you
you.
so much.
Thank you.
Thank you.